There are a lot of myths about scleroderma and skincare and a lot of autoimmune diseases in general. Once you're diagnosed with scleroderma, people hit the internet and they read things and they see incurable. But it's important not to panic because there's so much that you can do ahead of time so that you're in control of the disease and the disease is not in control of you. Neuropathy is a complicated word that really means problems with your nerves. And it can occur in your hands and your feet. And that's especially common with people who have systemic scleroderma. Because you don't have adequate blood supply that's nourishing your skin and the vessels down there, you're also not nourishing your nerve endings. And nerve endings are really important. That's how we sense whether we have pressure or trauma, whether we're hurting or whatever else is going on. It can be totally numb, or it can feel like needles and pins. And it can occur kind of gradually. You usually don't wake up one morning and have a numb foot. If you've ever fallen asleep on your foot and then try to get up and walk, you know that painful needles and pins feeling, and your foot feels really heavy and you're not able to know how to step down, or it affects your gait. That's what somebody with neuropathy feels like. Only they feel like that every day. And then gradually, as the neuropathy worsens, they can get to the point where they really don't have sensation. And believe it or not, pain is a good thing. Pain lets us know that something's wrong, that you're wearing the wrong shoes, or something is wrong with your foot. If somebody has neuropathy, they don't know that. There are some really important things that people with scleroderma can do to keep their skin intact, head to toe. The important thing is skin inspection so that you have a baseline and you know what's going on, and that includes your scalp, from head to toe, all the way from your scalp all the way down to your toes, and looking between your toes and the underside of your foot. Using a lighted magnifying mirror, a telescoping mirror, is very helpful for looking at the bottom of your foot. Then using your bathing products appropriately. Using a pH-balanced skin cleanser is the best thing you can do to your skin to keep it clean, but also keep it moisturized, and that will help keep it intact. Then when you look at your skin and you make sure you've cleaned between your toes and you're really dry between your toes, then applying your Fragile Skin Protective Ointment, because there's a tendency to get really dry on the heels and the toes, and then putting cotton socks on after you've put your moisturizer on will really help retain that moisture and help keep your feet healthy. Proper fitting shoes is absolutely essential. Making sure that you go to somebody that knows how to fit shoes. They may be known as a podorthist, it depends on your area, but specialized orthotics, not the ones that you can find just in a mail order catalog. And special order shoes are really important to make sure that it's properly fitted for you and your foot, as well as your gait. They will measure your pressure points and how you kind of strike down differently with your foot when you walk. Most people wear the same shoe size that they started wearing when they were in high school, and their footwear is totally wrong. Our feet change. Our feet get bigger. They usually get wider. Gravity tends to work. So those shoes that when you were 18 were perfect, they're not any good anymore now that you're 35, 50, 60, 70. So making sure that you take care of your feet. Same thing with your hands. People with scleroderma have a condition called Raynaud's disease. And what that means is that you have an intolerance to cold. So you're not responding to changes in temperature. So you need to wear gloves almost year-round, and especially if you're in a cold climate. You need to be careful to be sure that your feet are warm enough and that your hands are warm enough. Doing the same thing with your hands as you do with your feet, using a no-rinse foaming skin cleanser, making sure that you check between your fingers, that everything is nicely patted dry, and then you add your moisturizing ointment. Even while your skin is just slightly damp, that will help retain some of that moisture in your skin, and then put on your gloves. And then that will keep your hands warm and safe, and hopefully prevent any trauma from cold.